Hi everyone, we're Mimicker, here to integrate all kinds of knowledge, even stuff we didn't know about. Welcome to the deep dive. Okay, so today we're going to unpack an illness that's, well, so debilitating its name actually means that which bends up. We are talking about chikungunya. And, this isn't some far-off tropical issue anymore. It's a virus that's kind of quietly moved across continents. It's evolved, and it's really become quite a profound global health challenge.
Yeah,
Our sources for this deep dive, they're full of really detailed scientific analysis, and they show us, chikungunya is way more than just a fever and a rash.
absolutely.
It's this compelling story of how viruses adapt, how ecological changes have ripple effects, the huge impact of our interconnected world, globalization, and yeah, ultimately a pretty significant socioeconomic burden.
You've really hit the nail on the head there. That's why this matters so much. Um, while chikungunya often doesn't kill a lot of people, it's real, that bent-up impact. It's in the severe long-term effects.
Yeah.
So our mission today really is to explore its biology, track how it spread, like everywhere, understand the symptoms, both acute and those lasting ones, and then look at how we diagnose it, treat it, prevent it. We want to get to why it matters, for you listening and for global health systems.
Okay, let's start with that name because it's so vivid. Chikungunya. It's from the Kimakonde language, first noted down in southern Tanzania. And it literally describes that awful stooped posture you see in patients, that which bends up.
Yeah, to become contorted.
Exactly. That severe joint pain, it's the absolute hallmark. And they recognize that right back when the virus was first identified, Tanzania in 1952. It's a powerful image.
It really is. Tells you so much just from the name. Now, to understand that pain, we kind of need to zoom in, look at the microscopic level. So an infected mosquito bites someone. The virus gets into the bloodstream. And it doesn't just hang around. It actively starts replicating inside various cells, like epithelial, endothelial cells, fibroblasts, even immune cells like monocytes and macrophages.
Wow, so quite a range of targets.
Yeah, in this replication, it's cytopathic. That means it actually damages or kills the cells as it multiplies. And here's where the severity kicks in. During that acute phase, the virus triggers this massive inflammatory response.
Okay.
Your immune system goes into overdrive, pumping out these pro-inflammatory signals, cytokines like IL-6, IL-1, chemokines 2. It's this huge surge, sometimes called a cytokine storm.
Right, I've heard that term.
And that storm is directly linked to how sick you get in the acute phase. But what's really tricky and kind of fascinating is that even after your body clears the virus from the blood, leftover bits of virus, or maybe just the inflammation itself, can keep simmering away, especially in the joints.
Ah, so that's the chronic part.
Exactly.
Yeah.
That leads to that awful chronic arthritis that can drag on for months, sometimes even years, which tells us, treatment can't just be about killing the virus. We also need to think about managing that immune response to prevent the long-term stuff.
So it's like the body's own defenses end up causing the long-term damage. Complex. And this virus, you mentioned adaptation, it sounds like it's a master at it, which explains the global spread.
Absolutely critical. It's key to the whole story. Originally, we saw like 3 main genetic branches or lineages.
Yeah.
East Central South African, that's ECSA, West African, and Asian.
Okay.
But the real turning point, the moment chikungunya really went global, was after 2004. That's when a specific genetic mutation popped up.
A mutation, what did it do?
Well, this mutation allowed the virus to be transmitted much, much more efficiently by a different mosquito, the Asian tiger mosquito, Aedes albopictus.
Ah, the tiger mosquito. I know that one. They're everywhere.
Exactly. And that was the game changer.
Yeah.
Aedes albopictus has a way broader geographical range than the sort of traditional vector, Aedes aegypti. So suddenly, the virus had access to this huge new transmission network.
Like upgrading its delivery service?
Pretty much. And crucially, in many of these new areas, the albopictus mosquitoes and the human populations hadn't seen this specific virus variant before. They were immunologically naive.
So no resistance.
Right. So by hitching a ride with this new widespread mosquito, the virus basically broke out of its old geographic limits and just exploded globally into populations that couldn't fight it off easily. That drove the pandemic.
Wow. Okay, so that adaptation really paved the way for its global tour.
It really did. I mean,
Yeah.
for decades after 1952, chikungunya was mostly found in parts of Africa and Asia. You had that first big urban outbreak, Thailand 67, and India in the 70s. But like you said, post-2004 really shows the power of globalization.
Right.
2005, massive epidemic at Indian Ocean Islands, Southeast Asia. Then a huge step. 2007, first time it shows up properly in Europe. Italy had an outbreak, nearly 200 people.
In Italy,
Yeah, and then December 2013, another massive milestone. First local transmission in the Americas. Started in St. Martin, then just boom, spread like wildfire through the Caribbean, Central America, South America, even reaching North America.
So it jumped continents.
Effectively, yeah. It moved from the quote-unquote old world to the new world. Set up shop, established sustained transmission. Now it affects over 110 countries. And if you map its spread, it lines up almost perfectly with international travel routes, trade routes.
Yeah.
It really highlights how connected we are.
It certainly does. And these Aedes mosquitoes are the key players in that spread. You mentioned Aedes aegypti and Aedes albopictus.
Those are the main ones, yeah.
And the tricky part is they also carry dengue and Zika, right?
That's a major headache for public health. You get what's called co-circulation. All three viruses potentially spreading in the same place at the same time. Makes diagnosis really tough.
I can imagine. And these mosquitoes, they're day biters.
Primarily, yes. And they love breeding in containers with standing water, often right near where people live. Think flower pots, old tires, buckets, that sort of thing.
So they're basically urban mosquitoes living alongside us.
Very much so, which makes transmission super efficient and closely tied to our living environment. The cycle itself is pretty standard for these things. Human, mosquito, human.
Okay, walk us through that.
Sure. An infected mosquito bites a person, virus gets in their blood, starts multiplying. Then, if an uninfected mosquito bites that person while the virus levels are high in their blood,
The mosquito gets infected.
right, the virus replicates inside the mosquito, travels to its salivary glands, and then the next time that mosquito bites someone, boom, it injects the virus, passing it on. And the cycle continues, driving outbreaks.
Yeah.
It's depressingly efficient.
It sounds... So where are we seeing chikungunya hotspots right now, say mid-2025?
Okay, looking at the latest data, around July 2025, we're seeing roughly 240,000 cases globally, about 90 deaths reported across maybe 16 countries or regions.
And where are the highest numbers?
The Americas region is still leading. Brazil, for example, huge numbers, over 185,000 cases. Bolivia's reported over 4,700. Asia's seen over 34,000 cases this year.
Any specific outbreaks standing out?
Well, the outbreak in Foshan in Guangdong, China, is a really good, if unfortunate, example. Over 7,000 infections there. It really showed how fast this thing can spread in a population that hasn't encountered it before. That immunologically naive population again.
Right.
The authorities there actually got quite tough on vector control, using drones to spot stagnant water, even finding people who didn't clear potential breeding sites.
Wow, drones for mosquito control.
Elsewhere, Europe's had dozens of local cases, mostly France, Italy. French overseas territories like Reunion saw a massive spike, over 54,000 cases. And places like Taiwan, which aren't endemic, are focused on imported cases. They had 17 this year, a 6-year high, mostly people coming from places like Indonesia. Shows why airport checks are still vital.
That global snapshot, the numbers you mentioned, they really drive home how widespread this is. Now let's talk about the experience. What does it actually feel like to get chikungunya?
Right, the clinical picture.
Yeah.
So after the bite, there's an incubation period, usually about 3 to 7 days, but it can be up to 12. Then it hits you, usually quite suddenly. High fever, often over 39 Celsius or 102 Fahrenheit. And the defining thing, severe debilitating joint pain. It's typically polyarthralgia, meaning multiple joints, and often symmetrical so, both wrists or both ankles. Small joints in the hands and feet are common targets too, often with visible swelling.
That sounds miserable. What else?
Muscle aches are common, headache, nausea, fatigue, sometimes a rash. But here's a kicker. Somewhere between, say, 15 and 35% of people infected might have no symptoms at all.
Really? Asymptomatic.
Yep, they get infected, develop immunity, but never feel sick, which you can imagine makes tracking and controlling the virus much harder.
Definitely. And you mentioned distinguishing it from dengue earlier.
Yeah, that's crucial where they overlap. Dengue often has that pain behind the eyes, retroorbital pain. It's also more associated with low platelet counts and bleeding risks. For chikungunya, the real standout feature is that severe symmetrical joint pain. That's the big clue, usually.
Okay. But this story doesn't end when the fever breaks, right? You mentioned the long-term burden.
Exactly. And this is why chikungunya's true impact is often missed. Most of the acute stuff, fever, rash, might clear up in a week or 10 days. Looks like you're better. Yeah. But for a huge chunk of people, that joint pain just doesn't go away.
Oh.
It can persist for weeks, months, or sometimes even years. This is what we call chronic chikungunya arthritis.
And how common is that?
Studies suggest at least 40% of people who get infected develop some form of this chronic joint problem. 40%.
That's a huge number.
It is. And think about the impact. Persistent pain, stiffness, reduced mobility. It can absolutely wreck your quality of life, makes it hard to work, do daily chores, care for family.
And are some people more likely to get this chronic phase?
Yeah, the risk seems to be higher for people over 45 and also for those who already had some kind of joint issue like osteoarthritis before they got infected.
So the low death rate is deceptive. The real burden is this long-term disability.
Precisely. That's the silent burden. You have to look beyond just mortality stats and consider the long-term health impact, the social cost, the economic cost. It's significant.
Oh. And while deaths are rare, you said they do happen, especially in certain groups.
That's right. The elderly and people with underlying conditions, heart problems, diabetes, things like that, they are at higher risk of severe disease and death.
And newborns, too, you mentioned.
Yes, that's a really concerning aspect. Vertical transmission. If a mother is viremic, meaning the virus is actively circulating in her blood right around the time of delivery, there's up to a 50% chance she can pass it to her baby.
Wow, 50%. And what happens to the baby?
It can be very serious. Complications like hemorrhagic symptoms, myocarditis, inflammation of the heart muscle, neurological problems. It's a major concern for maternal and child health in affected areas.
Definitely. And there are other rare complications, too.
Yes, though less common, chikungunya can sometimes affect the eyes, the heart in other ways, or the nervous system. It just reinforces that it's not just about joints, it can be a systemic illness.
Okay, so given all this complexity and the overlap with dengue and Zika, how do doctors actually diagnose it?
That's the million-dollar question in many clinics. It's tough based on symptoms alone. So the approach has to combine a few things. The clinical picture, the patient's travel history or where they live, the epidemiology, and critically, lab tests.
What kind of lab tests?
It depends on timing. In the first week or so, when the virus is still actively replicating in the blood, the best bet is nucleic acid testing, usually RT-PCR. That directly detects the virus's genetic material.
And later on?
After about a week, the body starts producing antibodies. So you can do serological tests to look for specific IgM antibodies against chikungunya.
Okay, but you mentioned cross-reactivity earlier.
Exactly, especially with dengue, which is also a flavirus in some classifications. Wait, no, chikungunya is an alpha virus, dengue is a flavirus, but the antibodies can still sometimes cross-react in certain tests. So if dengue is also circulating, positive antibody test might need confirmation with a more specific test, like a plaque reduction neutralization test, or PRNT, just to be sure.
Right, so it can get complicated. Is there a key tip for managing patients when you're not sure if it's chikungunya or dengue?
Absolutely critical tip. If dengue is a possibility or hasn't been ruled out, stick to acetaminophen paracetamol for fever and pain. You need to avoid NSAIDs like ibuprofen and definitely avoid aspirin.
Why is that?
Because dengue carries a risk of bleeding, and NSAIDs and aspirin can increase that risk. So until you're sure it's not dengue, acetaminophen is the safer choice for symptom relief.
That makes sense. Safety first. Now, what about specific treatments for chikungunya itself? Any magic bullets?
Not yet, unfortunately. There are currently no specific antiviral drugs approved just for chikungunya. Treatment is still primarily supportive.
Meaning
Rest, lots of fluids to stay hydrated, and using those pain relievers and fever reducers we just talked about carefully, of course.
And for the chronic joint pain?
For the chronic phase, people might use NSAIDs again once dengue is ruled out.
Yeah.
Sometimes corticosteroids for bad flare-ups, and physical therapy can be really important to maintain joint function.
Is there hope for specific antivirals down the line?
Oh, definitely. Research is very active. Scientists are testing various drugs that target different parts of the virus's life cycle, trying to block it from entering cells, messing with its replication machinery. Drugs like chloroquine, ribavirin, favipiravir have shown some potential in lab settings, but nothing's crossed the finish line into approved treatment yet.
Okay, so treatment is supportive, but what about prevention? Vaccines, that seems like the big hope.
And there's actually really good news on that front. We've seen major breakthroughs recently. There are now 2 chikungunya vaccines approved, at least in the U.S.
2, that's fantastic news. Tell us about them.
Okay, so one is called IXCHIQ. It's a live attenuated vaccine, meaning it uses a weakened form of the virus. It got approved in 2023 for adults 18 and older. Studies showed really high seroconversion, like 99% of people develop antibodies after 4 weeks. And it seems to last, well, over 96% still protected after 3 years.
Impressive. And the second one?
The second is Chikungunya. This one uses a different technology. It's a virus-like particle vaccine. It was approved more recently in 2025 for people aged 12 and up. It also showed good results, 98% seroconversion in the 12-64 age group, a bit lower but still strong at 87% in those 65 and older.
So who should be getting these vaccines?
Right now, the main recommendations are for people traveling to areas where chikungunya is common, especially if they're high-risk travelers, and also for lab workers who might handle the virus.
Okay. Are there any downsides or concerns with these vaccines?
Well, there's an important point about IXCHIQ, the live attenuated one. There were reports of some serious side effects after vaccination, things like cardiac or neurological issues, specifically in people aged 65 and older.
Oh, okay.
Yeah, so because of that, there's now a specific precaution for that age group. They need careful medical evaluation before getting IXCHIQ. It just highlights, that even with exciting new tools like vaccines, public health decisions are complex. It's not always straightforward.
Absolutely. That nuance is crucial. Okay, let's zoom out again and think about the broader impact. What does a big chikungunya outbreak do to a healthcare system?
It puts immense strain on it, especially in places where resources are already stretched thin. Imagine hundreds, maybe thousands, of people getting sick very quickly.
Right.
You run into shortages, not enough staff, not enough hospital beds, running out of medications, and that diagnostic difficulty we talked about, trying to sort out chikungunya from dengue or Zika, just adds to the workload and the stress.
And it's not just the initial wave, is it? It's the chronic cases, too.
Exactly. That's the long tail. The acute outbreak might pass, but then you have this large group of people needing ongoing care for chronic arthritis for months or years. It's a persistent drain on resources, affecting budgets, staff time, everything, long after the headlines fade.
Which leads perfectly into the economic side. What's the price tag on chikungunya?
It's multi-layered. You've got the direct costs, doctor visits, hospital stays, medications, lab tests. That hits individuals and health systems hard financially. But then you have the indirect costs, which can be even bigger. That's mostly lost productivity. People are too sick to work during the acute phase, and then many face long-term disability because of the chronic arthritis.
Can you put a number on that?
For one example, a study looked at an outbreak in Indonesia back in 2012. They estimated the total economic cost was somewhere between 13 and 34 million US dollars for one outbreak.
Wow. That's substantial.
It really is, and it highlights that point again. Low mortality doesn't mean low economic impact, because so many people get sick, and many are affected long-term during their prime working years. The overall economic and social cost can actually be higher than for some diseases that kill more people. Plus, you have the psychological toll, anxiety, depression from chronic pain. It all adds up.
It really paints a picture of a wide-ranging burden. So, given all that, prevention is key. How do we stop the spread effectively?
The absolute bedrock is avoiding mosquito bites. Simple as that sounds, it's the most crucial thing.
So, personal protection.
Yes. Using good insect repellent things with ET, picaridin, oil of lemon, eucalyptus, wearing long sleeves and pants, especially during the day when Aedes mosquitoes bite. Treating clothes with permethrin can help too. Using screens on windows and doors, air conditioning if possible, and bed nets, particularly insecticide-treated ones if you're sleeping in areas without good screening.
And what about the community level? Beyond individual actions?
Community involvement is absolutely vital. Because these mosquitoes breed in water containers around homes, getting rid of those breeding sites is key. Public awareness campaigns are important, teaching people to empty standing water from flower pots, tires, gutters, pet bowls, etc.
So it's not just up to the government to spray insecticides.
Spraying can help knock down adult mosquito populations during an outbreak, sure. But sustained control really depends on everyone in the community actively eliminating those breeding spots. Remember that Foshan example in China? Using drones, issuing fines. That shows how seriously authorities sometimes need to take source reduction. It really takes a combined effort, from individual habits to strong public health policies. It's a long-term battle.
It definitely sounds like it requires effort on all fronts. So wrapping this up, what are the main takeaways from this deep dive?
Well, if we connect all the dots, Chikungunya's story, moving from this sort of localized disease to a global headache, it really shows us how things like viral evolution, globalization, maybe climate change, and just how we live all interact.
Right.
And that bent-up truth, the core message, isn't just about that initial fever. It's about the huge burden of chronic arthritis affecting, potentially up to 40% of people, causing long-term suffering and massive socioeconomic costs that we often overlook.
It's a powerful reminder. And I guess this deep dive into chikungunya makes you think. In our connected world, something starting locally can spread globally so fast. It leaves me wondering what other emerging diseases might be out there, maybe adapting and spreading quietly right now. And more importantly, how ready are we globally to face them? Not just reacting, but with, integrated thinking and real cross-disciplinary teamwork from the start. That's definitely something to ponder. Thanks for tuning in to this episode. If you enjoyed our content, don't forget to like, subscribe, and turn on the notification bell.